Question 1. Which of the following best describes the ALARA principle in medical imaging? A. As low as reasonably achievable. B. Always limit all radiation annually. C. Administer low amounts of radiation appropriately. D. Avoid limiting any radiation assessment. Answer: A. As low as reasonably achievable. This question tests your understanding of a fundamental radiation safety principle, and the keyword ALARA is a direct clue to its full meaning. ALARA stands for as low as reasonably achievable, which means that every effort should be made to reduce radiation exposure to patients and staff, as long as it does not compromise the diagnostic quality of the image. For example, using appropriate shielding or optimizing exposure factors are ways to apply ALARA in practice. Always remember that while radiation is necessary for imaging, minimizing exposure is always the priority. Question 2. What is the primary purpose of a lead apron worn by a technologist during a fluoroscopy procedure? A. To prevent static electricity discharge. B. To reduce scattered radiation exposure. C. To provide warmth and comfort. D. To improve image quality for the patient. Answer: B. To reduce scattered radiation exposure. This question focuses on radiation protection for the technologist, and the keyword lead apron directly points to its function. The primary purpose of a lead apron is to attenuate, or reduce, the amount of scattered radiation that reaches the technologist's body during X-ray procedures like fluoroscopy, where continuous radiation is used. Scattered radiation originates from the patient and imaging table, traveling in all directions, so personal protective equipment is crucial. Think of it as a personal shield, significantly decreasing your occupational dose. Question 3. Before administering intravenous contrast media, which of the following patient details is most crucial to verify? A. Shoe size. B. Allergies, especially to iodine or contrast. C. Favorite color. D. Last meal consumed. Answer: B. Allergies, especially to iodine or contrast. This question tests a critical aspect of patient safety when using contrast media, and the phrase "most crucial to verify" highlights the importance of identifying potential risks. Verifying a patient's allergy history, particularly to iodine or previous contrast media, is paramount because allergic reactions can range from mild to severe, including life-threatening anaphylaxis. Administering contrast without this check could put the patient in grave danger, so always confirm this information before proceeding. Ensuring patient safety through thorough screening is always your top priority. Question 4. What component of the X-ray tube is responsible for producing the electrons that are accelerated towards the anode? A. Stator. B. Rotor. C. Cathode. D. Anode. Answer: C. Cathode. This question delves into the basic components of an X-ray tube, and the clue producing the electrons directly points to the cathode's role. The cathode is the negative electrode within the X-ray tube and contains the filament, which, when heated, undergoes thermionic emission, releasing a cloud of electrons. These electrons are then accelerated across the tube towards the anode to produce X-rays. Think of the cathode as the electron source that gets the X-ray production process started. Question 5. Which imaging modality utilizes high-frequency sound waves to create images? A. Computed tomography, CT. B. Magnetic resonance imaging, MRI. C. Ultrasound. D. Nuclear medicine. Answer C. Ultrasound. This question asks you to identify an imaging modality based on its energy source, and the specific phrase high-frequency sound waves is the key identifier. Ultrasound imaging works by transmitting sound waves into the body, which then reflect off tissues and organs to create real-time images without using ionizing radiation. This makes it particularly useful for examining soft tissues, fluid-filled structures, and for obstetric imaging. Remember that ultrasound is unique among these options for its reliance on sound, not radiation or magnetism. Question 6. A patient arrives for an X-ray of their left wrist, but the requisition states a right wrist X-ray. What is the most appropriate action for the technologist? A. Proceed with the left wrist X-ray as the patient requested. B. X-ray both wrists to be safe. C. Contact the ordering physician for clarification before proceeding. D. Perform the right wrist X-ray as stated on the requisition. Answer C. Contact the ordering physician for clarification before proceeding. This question tests your understanding of patient safety and professional responsibility, with the discrepancy between the patient's statement and the requisition being the critical clue. When there is any doubt or conflict regarding the anatomical part to be imaged, the most appropriate and safest action is to stop and clarify with the ordering physician before proceeding. Imaging the wrong body part, known as a wrong site error, is a serious patient safety event that must be avoided at all costs. Always remember, if something feels off, verify it. Question 7. What is the primary function of the collimator in an X-ray unit? A. To cool the X-ray tube. B. To filter low-energy X-rays. C. To restrict the size and shape of the X-ray beam. D. To convert X-rays into visible light. Answer C. To restrict the size and shape of the X-ray beam. This question addresses a key component of radiation protection and image quality, and the term collimator directly relates to beam shaping. The primary function of the collimator is to restrict the size and shape of the X-ray beam to the area of interest, thereby reducing patient dose by minimizing the volume of tissue irradiated and decreasing scattered radiation. This precise beam limitation is essential for both patient safety and producing a clear diagnostic image. Always think of the collimator as the control for where the X-rays go. Question 8. Which of the following is considered a primary control for radiographic density on a film-based imaging system? A. Kilovoltage peak, kVp. B. Object to image receptor distance, OE-day. C. Milliampere seconds, MOS. D. Source to image receptor distance, SE-day. Answer C. Milliampere seconds, MOS. This question focuses on radiographic exposure factors, and the keyword primary control for radiographic density is the main clue. On a film-based system, milliampere seconds, MOS, directly controls the quantity of X-rays produced, which in turn is the primary factor affecting the overall radiographic density, or darkness, of the image. While kVp also affects density, MOS is considered the direct and primary controller. Think of MOS as controlling the amount of X-rays reaching the film. Question 9. For a female patient of childbearing age, what is the most important question to ask before an X-ray of the abdomen or pelvis? A. Are you currently feeling any pain? B. When was your last menstrual period? C. Have you eaten anything today? D. Are you comfortable on the imaging table? Answer B. When was your last menstrual period? This question highlights a crucial aspect of radiation protection for a specific patient demographic, with female patient of childbearing age and abdomen or pelvis being critical clues. It is essential to determine if there is any possibility of pregnancy to protect the fetus from radiation exposure, as the developing embryo is very radiosensitive. Asking about the last menstrual period is a standard and effective way to screen for potential pregnancy risk before imaging these sensitive areas. Always prioritize confirming pregnancy status in these situations to ensure fetal safety. Question 10. What does the term radiopaque describe in the context of X-ray imaging? A. A substance that easily allows X-rays to pass through, appearing dark on an image. B. A substance that absorbs X-rays, appearing bright or white on an image. C. A substance that emits its own radiation, appearing as a blurred area. D. A substance that reflects sound waves, appearing as an echo. Answer, B. A substance that absorbs X-rays, appearing bright or white on an image. This question tests your understanding of basic radiographic terminology, and the word radiopaque is the key concept. Radiopaque materials, such as bone or contrast media containing iodine or barium, absorb a significant amount of X-ray photons, preventing them from reaching the image receptor. This results in an area of decreased exposure on the image, which appears bright white. Think of radiopaque substances as blocking the X-rays, much like a thick wall blocks light. Question 11. Which of the following ethical principles emphasizes the patient's right to make decisions about their own medical care? A. Beneficence. B. Non-maleficence. C. Autonomy. D. Justice. Answer, C. Autonomy. This question delves into fundamental ethical principles in healthcare, and the phrase patient's right to make decisions about their own medical care directly defines the concept. Autonomy means self-governance, respecting an individual's right to make choices, including accepting or refusing medical treatment, provided they have the capacity to do so. This principle is foundational to informed consent. Understanding autonomy helps you respect your patient's wishes and involve them in their care decisions. Question 12. What is the typical effect of increasing the kilovoltage peak, kVp, in X-ray imaging, assuming MOS is adjusted to maintain density? A. Increased image contrast. B. Decreased image contrast. C. Decreased spatial resolution. D. Increased patient dose. Answer, B. Decreased image contrast. This question explores the relationship between exposure factors and image quality, with increasing kVp and assuming MOS is adjusted to maintain density as key conditions. Increasing kVp means the X-ray photons have higher energy and are more penetrating, leading to a wider range of tissue densities being penetrated and less differential absorption. This results in an image with more shades of gray and therefore lower image contrast. Think of higher kVp as creating a softer or more uniform image, reducing the difference between light and dark areas. Question 13. What is the purpose of placing a lead shield over a patient's gonads during an X-ray examination? A. To improve image quality by reducing scatter. B. To keep the patient warm and comfortable. C. To protect reproductive organs from unnecessary radiation exposure. D. To prevent patient movement during the exposure. Answer, C. To protect reproductive organs from unnecessary radiation exposure. This question is about a specific patient radiation protection technique, and the keywords lead shield and patient's gonads are direct clues. The purpose of gonad shielding is to protect the reproductive organs from unnecessary direct and scattered radiation, as these organs are particularly radiosensitive. While it can also slightly reduce scatter, its primary and most important role is direct organ protection, helping to preserve genetic integrity. Always apply gonad shielding when appropriate, ensuring it does not obscure the area of interest. Question 14. Which of the following actions should be taken immediately if a patient experiences a severe allergic reaction to contrast media? A. Offer the patient a glass of water. B. Reassure the patient and continue the procedure. C. Stop the contrast infusion, call for medical assistance, and monitor vital signs. D. Document the reaction after the patient leaves the department. Answer: C. Stop the contrast infusion, call for medical assistance, and monitor vital signs. This question assesses your knowledge of emergency procedures during contrast administration, and severe allergic reaction and immediately are crucial indicators for urgent action. If a patient shows signs of a severe reaction, the first and most critical steps are to stop the administration of the contrast, immediately alert medical personnel, e.g., a radiologist or nurse, and closely monitor the patient's vital signs to assess their condition. Rapid intervention is key to managing such emergencies effectively. Your quick response can make a significant difference in patient outcome. Question 15. What is the correct medical term for a broken bone? A. Edema. B. Fracture. C. Contusion. D. Sprain. Answer: B. Fracture. This question tests basic medical terminology, specifically relating to musculoskeletal injuries. The term broken bone is a common way to describe a fracture, which is the medical term for a discontinuity or break in the integrity of a bone. While edema is swelling, a contusion is a bruise, and a sprain involves ligaments, a fracture specifically refers to the bone itself. Understanding these basic terms is essential for accurate communication in a clinical setting. Question 16. In digital radiography, what does pixel pitch primarily influence? A. Image contrast. B. Spatial resolution. C. Radiographic density. D. Patient dose. Answer: B. Spatial resolution. This question delves into concepts specific to digital radiography, and pixel pitch is a direct indicator of image detail. Pixel pitch refers to the distance between the centers of adjacent pixels in a digital detector. A smaller pixel pitch means more pixels are packed into a given area, allowing for finer detail to be captured, which directly results in higher spatial resolution, the ability to distinguish small objects. Think of it as the graininess of a digital image. Smaller grains mean a clearer picture. Question 17. What type of consent is typically required for an invasive procedure like a biopsy? A. Implied consent. B. Verbal consent. C. Informed consent. D. Emergency consent. Answer: C. Informed consent. This question focuses on patient rights and legal considerations, with invasive procedure like a biopsy being the key factor. For any invasive or risky procedure, comprehensive informed consent is legally and ethically required. This means the patient must be given a clear explanation of the procedure, its risks, benefits, alternatives, and has the opportunity to ask questions before voluntarily agreeing. Implied consent is for routine, non-invasive procedures, while verbal consent is not always sufficient for invasive ones. Question 18. What is the primary reason for instructing a patient to hold their breath during a chest X-ray? A. To increase patient comfort. B. To reduce patient movement and improve image clarity. C. To distribute contrast media evenly. D. To decrease radiation exposure. Answer: B. To reduce patient movement and improve image clarity. This question relates to patient cooperation and image quality, with hold their breath and chest X-ray providing the context. The primary reason for instructing a patient to hold their breath during a chest X-ray is to minimize motion blur caused by respiration. Holding the breath stabilizes the chest wall and diaphragm, ensuring the heart and lungs are captured clearly and sharply, which is crucial for diagnostic accuracy. Think of it as pressing the pause button on internal movement during the exposure. Question 19. Which of the following is an example of an involuntary muscle contraction that can affect image quality? A. Patient holding their breath. B. Tremors due to Parkinson's disease. C. Patient turning their head to speak. D. Technologist moving the X-ray tube. Answer, B. Tremors due to Parkinson's disease. This question distinguishes between voluntary and involuntary motion that can impact images, and the keyword involuntary is critical. Involuntary muscle contractions are those the patient cannot consciously control, such as heartbeats, peristalsis, movement of digestive organs, or tremors from conditions like Parkinson's disease. These movements can cause motion blur on an X-ray image even if the patient is trying their best to cooperate. Understanding involuntary motion helps technologists anticipate and adapt techniques to minimize its effects. Question 20. When preparing to transfer a patient from a stretcher to the X-ray table, what is the most important initial step? A. Adjust the X-ray tube position. B. Ensure the stretcher and table are locked. C. Dim the room lights for comfort. D. Ask the patient about their medical history. Answer, B. Ensure the stretcher and table are locked. This question tests your knowledge of patient transfer safety, and, most important, initial step and transfer are key indicators for preventing falls. Before any patient transfer, it is absolutely critical to ensure that both the stretcher and the X-ray table are securely locked and cannot move. This prevents accidental rolling or shifting during the transfer, significantly reducing the risk of a fall and potential injury to both the patient and the technologist. Always remember, lock it before you rock it. Question 21. What is the purpose of an X-ray grid? A. To amplify the X-ray signal. B. To remove scattered radiation from the image-forming beam. C. To focus the X-ray beam onto the patient. D. To convert X-rays into light. Answer, B. To remove scattered radiation from the image-forming beam. This question focuses on a crucial component for improving image quality, and X-ray grid is the direct clue. The primary purpose of an X-ray grid is to absorb scattered radiation that originates from the patient before it reaches the image receptor. By removing scatter, the grid enhances image contrast and detail, making the diagnostic information clearer. Without a grid, scattered radiation would reduce image clarity, especially when imaging thicker body parts. Question 22. What is the annual effective dose limit for an occupationally exposed worker, as recommended by regulatory bodies in Canada, e.g., CAMRT? A. 1 MSV. B. 5 MSV. C. 20 MSV. D. 50 MSV. Answer, C. 20 MSV. This question tests a key aspect of radiation safety regulations for professionals, specifically annual effective dose limit for an occupationally exposed worker in Canada. Regulatory bodies like the Canadian Nuclear Safety Commission, CAMRT, specify an annual effective dose limit of 20 MSV, averaged over a 5-year period, for occupationally exposed workers. This limit is designed to ensure the safety of those working with radiation. It's essential to know these limits to maintain compliance and protect yourself and your colleagues. Question 23. A patient with a suspected C-spine injury arrives in the emergency department. What is the most appropriate method for moving this patient onto the X-ray table? A. Allow the patient to move independently, assisting as needed. B. Use a log roll technique with multiple personnel to maintain spinal alignment. C. Have the patient sit up and pivot onto the table. D. Lift the patient directly by their arms and legs. Answer B. Use a log roll technique with multiple personnel to maintain spinal alignment. This question is about patient safety during transfers for specific injuries, with suspected C-spine injury being the critical clue. For any patient with a suspected spinal injury, maintaining spinal immobilization and alignment is paramount to prevent further neurological damage. The most appropriate method is a log roll technique, performed by multiple trained personnel, which keeps the spine in a neutral position throughout the transfer. Always prioritize spinal precautions in these critical situations. Question 24. Which of the following conditions is an absolute contraindication for a magnetic resonance imaging (MRI) scan? A. History of claustrophobia. B. Pregnancy. C. Cardiac pacemaker. D. Metal dental fillings. Answer C. Cardiac pacemaker. This question tests your understanding of MRI safety, and absolute contraindication implies a condition that completely prohibits the scan due to severe risk. A cardiac pacemaker is an absolute contraindication for an MRI scan because the powerful magnetic fields can interfere with its function, potentially causing it to malfunction or heat up, which could be life-threatening. While claustrophobia and pregnancy require consideration, and dental fillings are usually fine, a pacemaker is a definite no-go without specific, MRI conditional device approval. Always rigorously screen for these devices. Question 25. What is the primary purpose of a timeout procedure before a surgical or invasive imaging procedure? A. To allow the patient to ask final questions. B. To confirm the correct patient, procedure, and site. C. To check the equipment for functionality. D. To review the patient's billing information. Answer B. To confirm the correct patient, procedure, and site. This question focuses on patient safety protocols, and the term timeout is a direct indicator of a crucial safety check. A timeout is a universal protocol initiated before invasive procedures, including some interventional imaging procedures, to ensure that the entire team pauses to confirm the correct patient, correct procedure, and correct anatomical site. This critical step helps prevent wrong patient, wrong procedure, and wrong site errors. Think of it as the final safety check before proceeding. Question 26. Which of the following factors would result in a decrease in radiographic image detail, spatial resolution? A. Using a small focal spot size. B. Increasing the source-to-image receptor distance, SE-day. C. Increasing the object-to-image receptor distance, OE-day. D. Using a slow image receptor speed. Answer C. Increasing the object-to-image receptor distance, OE-day. This question tests the factors affecting image quality, specifically spatial resolution, and the keyword decrease in radiographic image detail is key. Increasing the object-to-image receptor distance, OE-day, also known as the air gap, magnifies the image and, more importantly, increases geometric unsharpness or blur. This directly leads to a decrease in spatial resolution, making the image less sharp and harder to see fine details. Always strive to minimize OID whenever possible to maintain good detail. Question 27. When assessing a patient's vital signs, what does tachycardia refer to? A. Abnormally slow heart rate. B. Abnormally fast heart rate. C. Abnormally low blood pressure. D. Abnormally high body temperature. Answer B. Abnormally fast heart rate. This question tests basic medical terminology related to vital signs, and tachycardia is the specific term. Tachycardia refers to an abnormally rapid heart rate, typically defined as over 100 beats per minute for adults. It's important to recognize this and other vital sign abnormalities, as they can indicate a patient is in distress or experiencing a medical event. Think of tachy as meaning fast or rapid. Question 28. What is the primary purpose of applying compression during mammography? A. To reduce the patient's discomfort. B. To spread out the breast tissue and reduce superimposition. C. To increase the X-ray beam intensity. D. To decrease the exposure time, regardless of other factors. Answer B. To spread out the breast tissue and reduce superimposition. This question specifically addresses mammography technique, and compression is the key term. The primary purpose of applying compression to the breast during mammography is to spread out the breast tissue, reducing its thickness and separating overlapping structures. This minimizes tissue superimposition, allowing for better visualization of subtle abnormalities and reducing the amount of radiation needed. It also immobilizes the breast and reduces geometric unsharpness. Question 29. Which of the following is considered the most effective method for controlling the spread of infection in a healthcare setting? A. Wearing gloves for all patient contact. B. Routinely cleaning imaging equipment surfaces. C. Proper hand hygiene, e.g., hand washing, alcohol-based RABI. D. Administering antibiotics to all patients upon arrival. Answer C. Proper hand hygiene, e.g., hand washing, alcohol-based RABI. This question focuses on infection control, and most effective method is the crucial phrase. While all listed options contribute to infection control, proper hand hygiene, thorough hand washing with soap and water or using an alcohol-based hand rub, is universally recognized as the single most effective method to prevent the spread of infections. Healthcare-associated infections are a serious concern, and diligent hand hygiene by all staff is the frontline defense. Always make hand hygiene your priority between patients. Question 30. What does the acronym PACS stand for in medical imaging? A. Patient Access and Communication System. B. Picture Archiving and Communication System. C. Professional Anomaly Classification System. D. Personal Appointment Confirmation Service. Answer B. Picture Archiving and Communication System. This question tests your knowledge of common acronyms in the medical imaging field, and PACS is a fundamental system you will encounter. PACS stands for Picture Archiving and Communication System, which is a medical imaging technology that provides economical storage and convenient access to images from multiple modalities, such as X-ray, CT, and MRI. It has largely replaced hard copy film archives, allowing for digital viewing and sharing of images throughout the healthcare enterprise. Understanding PACS is key to modern medical imaging workflow.